Hello everyone, welcome back to my channel Microbiology Simplified. In this video of PYQ series, I have discussed sterilization and disinfection. And yes, I know all of you know that this is a very important topic, and that's why I made this video in such a way that you will get answer to all of the question asked in all the PG examination, including NEET, PG, INI-CET and FMGE. So in this video, I have discussed all the question asked in all the examinations in last 5 years. Okay, so let's start with the video. The MCQ asked which of the following sterilization and disinfection method cannot kill spores. So to kill the spore, what should be the level of disinfectant? High level, intermediate or low level? High level? No. High level disinfectant also cannot kill spore if they are present in large number. So only sterilization method can kill. So do you think that any one of these option can cause sterilization? So we'll see. Ethylene oxide, yes, it can lead to sterilization. Okay, so ethylene oxide is correct. Pasteurization, do you think pasteurization can lead to sterilization? No, pasteurization cannot cause sterilization. It is a high level disinfectant. Orthophthaldehyde, yes, it can cause sterilization. Glutaraldehyde, yes. But if I'm saying correct that glutaraldehyde, orthophthaldehyde, these are the chemical sterilant and these are commonly used as disinfectant. So why I'm saying that these can be used as an sterilizing agent? Anything I'm saying wrong, or this question itself is wrong? No, the question is also correct and I'm also saying correct. And why? We'll see in the discussion. So answer to this question is pasteurization, which cannot kill spores, because pasteurization is basically a high level disinfectant in which usually they don't kill spores, okay, but they can also kill spore. So there is some twist, we'll see in the discussion, okay. So the first process which I will discuss is sterilization. And what is the level of microbial inactivation which can be achieved by sterilization? It can destroy all microorganisms, including the spores. All microorganisms means all bacteria, viruses, fungus, everything, okay, including the spores. And what is the method of which can be utilized for sterilization? It can be heat, high temperature, it can be low temperature method, or it can be liquid immersion method. So example of high temperature method are steam sterilization, which can be done by autoclaving. Okay, steam sterilization, which can be done by autoclaving. Okay, and dry heat, which can be done by using hot air oven. Okay, and what is the application of this method in hospital is to sterilize heat tolerant critical items and heat tolerant semi critical items. Okay, so both these heat tolerant items can be sterilized by using either autoclave or by hot air oven. Now what are the low temperature methods? It includes ethylene oxide gas, hydrogen peroxide gas plasma, and hydrogen peroxide gas vapor. So these three methods can be used as an sterilization, and in these three methods temperature is not high, that is why it is called as low temperature method. So it can be used for heat sensitive critical item and heat sensitive semi critical items. Okay, now coming to the last one, that is liquid immersion. In this we can use chemical sterilants mentioned in the options, and those are glutaraldehyde with phenol. Glutaraldehyde alone can be used, hydrogen peroxide with peracetic acid, and orthophthaldehyde. So these three can be used for sterilization, but then they are chemical sterilants. So how they can sterilize? If the duration of exposure is increased from minutes to hours together, so these agents can be used as an sterilizing agent. And for those equipments it is used which can be immersed in the liquid, so those agents should be immersible, heat sensitive critical and semi critical items. Okay, now coming to the next process of disinfection is high level disinfectant. And what is the level of microbial inactivation which can be achieved? It can kill all vegetative microorganisms including the viruses, but it is not active against a spore if it is present in large number, but it may kill spores if they are present in smaller numbers. So usually they are inactive against spores, but they may kill the spores if they are present in smaller number. And what is the method? First is heat automated method, and second is Liquid immersion method. The heat automated method, which is commonly used as high level disinfectant, is the option given in the question, that is pasteurization. And the most common used of this pasteurization is for heat sensitive semi-critical item. And what is that semi-critical item which is typically sterilized by pasteurization in hospital is respiratory therapy equipment. So pasteurization in hospital is usually done for respiratory therapy equipment. And liquid immersion can be done by the previous chemical sterilant said in the sterilization process. Only the duration of exposure is reduced, and those are glutaraldehyde, hydrogen peroxide with peracetic acid, and it is used for heat sensitive semi-critical items. Okay, and those items are GI endoscopes, bronchoscopes, and endocavitary probes. Okay, now coming to the next process, that is intermediate level disinfectant, and the level of microbial inactivation is all vegetative microorganisms can be killed, including the mycobacteria and non-enveloped virus, but not the spores. So spores cannot be killed by intermediate level disinfectant even if it is present in a smaller number. And the method is liquid immersion or liquid contact. And the example of this intermediate level disinfectant is ethyl or isopropyl alcohol 70% concentration, sodium hypochlorite 5 to 6% concentration, phenolic compound Lysol, Cresol, and iodophores such as povidone iodine. And application in the hospital is for surface cleaning, okay, and for non-critical items. So usually for surface cleaning, sodium hypochlorite and ethyl or isopropyl alcohol is used, and for cleaning of non-critical items we can use ethyl alcohol, isopropyl alcohol. Phenols are also used for surface cleaning, and iodophores are used for cleaning the skin. It is commonly used as skin disinfectant along with ethyl or isopropyl alcohol. So these two are used as skin disinfectant. These two are used for surface cleaning. Remember, these two are used for skin disinfection or for usually for antiseptic procedure. Okay, and these two are used for surface cleaning. Okay, now the last process, that is low level disinfectant, and the level of microbial inactivation achieved is vegetative bacteria can be killed, and also some of the fungus and viruses can be killed, but not the mycobacterium and not the spores. So it cannot kill the mycobacterium and spores, but it may kill vegetative bacteria and some of the funguses and viruses. Okay, and the method is again liquid contact, and the commonly used agent for agent used as low level disinfectant is quaternary ammonium compound, and also the phenolic compounds can be used in a lower duration of exposure. And the application in the hospital is for non-critical items such as blood pressure curve and for surface cleaning with bedside table with no visible blood. Okay, so if visible blood is present, we will prefer intermediate level disinfectant such as sodium hypochlorite. So as I told you in this discussion about the items, that is critical, semi-critical, non-critical items. So this item are classified on the basis of what? On the basis of their use. So this classification of this item into critical, semi-critical and non-critical is called as Spalding classification. Okay, Spalding classification. So what is critical items? Critical items are those items which comes in contact with sterile tissue or vascular system, that is blood vessel or sterile tissue. If it come in contact with, it is called as critical item, and those items are, and these semi-critical items comes in contact with mucous membrane and non-intact skin. Okay, and this non-critical comes in contact with intact skin. So if it come in contact with the sterile tissue, critical, come in contact with mucous membrane, non-intact skin, semi-critical, come in contact with non-critical intact skin, it is non-critical items. And what are the critical items? Those are surgical instruments, cardiac catheters and implants. Semi-critical items are endoscopes, cystoscopes, respiratory therapy equipments and anesthesia equipments. And non-critical items such as bed pans, blood pressure cuffs and crutches. And what is the method of sterilization and disinfection of critical items? If you remember the table I told you, for critical item we will use sterilization. For semi-critical we will use high level disinfectant. For non-critical items we will use low level disinfectants. Okay. Remember, for non-critical item we may use intermediate level disinfectant, but commonly we use low level disinfectant. Okay. Remember this. Now we will see certain key points which may be important to answer questions which may be asked from this topic. So the first is inspection. Inspection is usually done for certain medium which contains heat sensitive constituents, such as LJ medium which contains egg yolk in it, okay, which is sensitive to heat and may coagulate at a high temperature, and Loeffler serum slope which contains serum. Okay, so this LJ medium is used for Mycobacterium tuberculosis and Loeffler serum is used for Corynebacterium diphtheria. So both of these medium contains constituents which may not tolerate a high temperature. So for that we will do inspection. So what should be the temperature for inspection? It should be less than 100, and in this method we sterilize the item at 80 degrees Celsius for 30 minutes for 3 consecutive days. Why 3 consecutive days? Because on the very first day, when it is heated at temperature 80 degrees Celsius, it will kill all the vegetative form of the bacteria. In the next 2 days, the spores which may be present in the medium will germinate into the vegetative form and will be killed on the further sterilization process. Okay, so this is the method known as inspection, done for LJ medium and Loeffler serum slope and other medium which contain heat sensitive constituents. Similar to it is sterilization, which is done for sugar and gelatin, which also cannot tolerate at a very high temperature. But in this, the sterilization is done at 100 degrees Celsius for 30 minutes for 3 consecutive days. So only difference is the temperature. Here the temperature is 80 degrees Celsius. Here is 100 degrees Celsius. Now the next is pasteurization. Pasteurization we have usually heard about pasteurization of milk. So pasteurization of milk is done by Holder method, flash process and ultra high temperature. Okay, and also we have heard the utilization of pasteurization in the discussion in the hospital setting, that is healthcare setting. Okay, so we'll see the Holder method. Holder method is holding the milk at a lower temperature for a longer duration. So this holder is also known as low temperature long time, LTLT. Okay, so temperature is 63 degrees Celsius for 30 minutes. You remember this, 63 for 30. Flash process is 72 degrees Celsius for 15 to 30 seconds and then rapidly cool it to 4 to 6 degrees Celsius. So this is high temperature short time, HTST. And what is ultra high temperature, in which we will use 135 to 140 degrees Celsius for 2 to 4 seconds. And in healthcare setting, what we use 70 to 72 degrees Celsius for 30 minutes. So this is the utilization of pasteurization in pasteurization of milk and for disinfection of respiratory equipments. Now certain more key points. Cold sterilization. Cold sterilization is those method which is used for heat sensitive articles such as pre-packed syringes, pre-packed cotton swabs we have seen. And in this method we usually utilize ionizing radiations and non-ionizing radiations. Ionizing radiation which is commonly used is X-rays and gamma rays, and non-ionizing radiation commonly used is UV rays and infrared rays. Okay. And then plasma sterilization. Plasma sterilization, which gas we will use for plasma sterilization? Hydrogen peroxide. And we will introduce this hydrogen peroxide to electromagnetic field. Okay, and this introduction to electromagnetic field will lead to generation of hydrogen free radical and oxygen free radical, and these two free radical will lead to denaturation of microorganisms. So this is plasma sterilization. So remember the name of the gas for plasma sterilization: hydrogen peroxide, H2O2. Okay, and it is exposed to electromagnetic field. Okay. Spill management. What happen if a blood or potentially infectious material will spill into the floor or to any surface? So how to manage that? So it totally depend upon the amount of spillage. So if the blood or other potentially infectious material If the amount is less than 10 ml, it will be called as small spill. Small spill, okay. And how to clean the spill? We will make a 1:100 dilution of 5.25 to 6.15, that is the normal bleaching powder, sodium hypochlorite. Normal bleaching powder solution is 5.25 to 6.15% sodium hypochlorite. We will make 1:100 dilution of this solution for small spill when the amount of blood is less than 10 ml. How much amount of available chlorine will be there in that? 525 to 616. Okay, just you need to multiply it with 100, okay, for this. And if the spill is more than 10 ml, it will be called as large spill. Okay, so for that, how much dilution of sodium hypochlorite is needed? 1:10 dilution of 5.25 to 6.15% of sodium hypochlorite, and it will give 5250 to 6160 ppm of available chlorine. So I have seen in a question this available chlorine was asked, so that's why I'm saying, and also this dilution. Okay, so remember, for a small spill 1:100, for large spill 1:10. So always see the amount of the blood spill mentioned in the question. If it is less than 10 ml, the dilution used is 1:100. If it is more than 10 ml, it is 1:10. Okay. So plasma sterilization makes use of which gas? Ethylene oxide, UV rays, gamma rays, hydrogen peroxide. What is the answer? I have told you, hydrogen peroxide, which is exposed to electromagnetic field, leads to generation of hydrogen free radical and oxygen free radical, and leads to denaturation of microorganism. Okay. Next question, a blood spill in operation theatre must be cleaned with which one? Sodium hypochlorite. Which one is sodium hypochlorite? Chlorine compound. Okay, so this is the correct answer. Next question, a phlebotomist unintentionally spill a 5 ml tube of blood while taking a blood sample for investigation. Which of the following solution is recommended? So what is the amount of blood spill? Large or small? It is 5 ml. So it is small spill. Okay. So what should be the answer? Dilution for a small spill less than 10 ml, it is 1:100. So answer to this question is 1:100 sodium hypochlorite solution. Which one of the following is a potent disinfectant? Potent disinfectant means a high level disinfectant. So we will see one by one. Isopropyl alcohol is intermediate level. Glutaraldehyde is both high level and also can be used as sterilizing agent. Iodophor is intermediate level. Benzalkonium chloride is a quaternary compound. It is low level. So answer is glutaraldehyde. Okay. Pasteurization is done at 72 degrees Celsius for 20 minutes, 63 degrees Celsius for 30 minutes, 72 degrees Celsius for 30 seconds, 63 degrees Celsius for 30 seconds. So what should be the answer? If it is mentioned pasteurization of milk, then it is very easy to answer that. Answer B is correct. 63 degrees Celsius for 30 minutes. Why this C is not correct, 72 for 30 seconds? Because then they should have mentioned the rapid cooling to 4 to 6 degrees Celsius. Otherwise this is incomplete process. So this is not correct. 63 for 30 seconds, this is also incorrect. 72 for 20 minutes is incorrect. If they would have mentioned 30 minutes, then this method is used for sterilization of respiratory equipment. So this may be correct if the duration is 30 minutes instead of 20 minutes. So answer to this question is 63 degrees Celsius for 30 minutes. This is the which method? Holder method. Okay. So I hope after this video you will be able to answer the questions related to this topic very easily. And if anything is missing, I will make another video from this topic. But till now, whatever question I've got from all the question bank and everywhere, these are the questions which is asked from this topic. So just go through this video and you will be able to answer all the questions from this topic. Okay. So don't worry, I will make another video for autoclave. I know this autoclave is a hot topic, but I will make a video for autoclave. But again, I have not yet got any MCQ for that. So I'll just see if I'll get any MCQ, I'll make the video. So all the best, take care, bye bye.